So let me tell you a little bit about our studies on preterm infants. We started off doing a study on immediate and delayed cord clamping in 1999 here with 32 infants randomized to immediate or delayed cord clamping. The delay was 30 to 45 seconds, and we lowered the babies down trying to get more blood. We found these babies had higher mean blood pressures, less suspected neck, less need for oxygen at discharge, and no adverse effects. We went on to do the next study, phase 1, with 72 babies, the same age, the same protocol. We found no difference in maternal and newborn demographics in these 72 babies, and no difference in any of the safety variables. The cord clamping time was 7 seconds in the immediate group and 32 seconds in the delayed group. But what we did find was an increase in intraventricular hemorrhage, which is shown here in yellow. The immediate clamp group is in yellow, the delayed clamp group is in red, and the y-axis on the left is the actual number of babies. So you can see that there were 13 babies in the immediate group that had IVH and 5 babies in the delayed group. And this did reach significance, but the confidence interval is quite wide, so it requires another study. We also found a difference in confirmed sepsis, no difference in suspected, but in confirmed sepsis. Again, the same ICC is yellow, delayed is red, although this one baby in red in the confirmed group was a protocol violation, so that baby actually had immediate cord clamping, and this is intention to treat analysis. So there were 9 babies altogether that had confirmed sepsis. Interestingly, we also noticed a gender difference, and the 42% of the boys here in the immediate clamp group on the left had IVH versus 9% of the boys with delayed clamping. And with sepsis, 32% of the boys had sepsis in the immediate group and none of the boys in the delayed group. And there were no differences amongst the girls. So when we followed that group of babies with the help of Dr. Vore till 7 months of age, we saw 85%. We saw no difference between the groups on their scores on the Baileys using t-test or chi-square, but when we used a multiple regression, we found that male infants who had delayed cord clamping at birth, when we controlled for bronchopulmonary dysplasia, intraventricular hemorrhage, and late onset sepsis, the boys who had delayed cord clamping had motor scores on the Bailey scales more than 1 standard deviation higher than the boys that had immediate clamping. So we wondered why. We looked at factors, and we talked about possibly blood volume loss, which could contribute to cardiovascular instability and loss of brain blood pressure, autoregulation, and poorer perfusion of the fragile especially the fragile germinal matrix where the IVH occurs. We wondered about, we do have references showing that inflammation can be caused secondary to blood loss alone without any other factors. And we wondered about loss of hematopoietic stem cells and other cord blood factors, and would that make a difference? So we designed another study to measure all those things, and we received an R01 for a 5-year study of 212 preterm infants. Again, the same age group, the same protocol, except we added on 1 milking of the cord before clamping, because so many of these babies, we go to clamp that cord at 30 to 45 seconds, and it's still full and huge, and so we thought we'd capture a bit more of the blood. Our primary outcomes on this study are IVH and sepsis. We also looked at biologic markers, cytokines at birth, at 6 and 20 hours, stem cells at birth and at 20 hours, and red cell volume when the babies got transfusions. And we're following them with motor function scores, motor function assessment at 7 and 18 months. All the 7-month babies have been seen. That we're going to see probably about 87% this time. And we're now analyzing our data, which I should have for you, except that the groups are very uneven, so that we're having to do more analyses. So I don't have this, but I have made an appointment with Lisa. I hope for a time in September when I will reveal all the preterm data. So you'll have to just hold on that one. One study, though, was done. You can see here that Ross Summers had a lot of support from Dr. Stonestreet and O and Laptook and myself, and he looked at the superior vena cava flow, which is the flow coming down, draining the head and the upper extremities. Of course, the baby's head is so huge compared to the rest of his body. It's probably mainly from his head. He did that with echocardiogram, and he measured it at around 6 hours, at 24 hours, at 48 hours, and between 96 and 120. And you can see here that he found an increase in the blood flow, the superior vena cava flow, at all points in time. I'm sorry, I don't have I think it was significant at 48 and 100 hours. Sorry, I don't have that on there. So that's been published, and that's all we've published so far.